Have you ever heard after a night out you can get a cold with cough, sneezing, and feeling extra crummy? It's not just a hangover. It's actually something more than that. Alcohol does decrease your immune system. I'm Dr. Mondala, and I'm here to talk to you about your immune system. I'm double boarded in family medicine and lifestyle medicine with an emphasis in integrative psychiatry. We're going to dive into this video and talk about the science behind alcohol and the immune system. It can be super complex, but I'll try to make it as simple as I can. So grab a cup of tea, because we're not talking about alcohol, and relax, get comfy, because there are 7 reasons why alcohol weakens the immune system. Number 1, there's gut disruption. What does that mean? So there is disruption of your intestinal lining, starting with actually your mouth, your esophagus, your gastric lining of your stomach, and your intestines. The microbiome is compromised and altered, so there is damage to the T cells, the neutrophils, the epithelial cells, which means the little cells in your gut. And that allows harmful bacteria to enter your bloodstream and spread inflammation and potentially increase the risk for disease and colds. Number 2, there's impaired white blood cell function. What are white blood cells? Basically, they are so important because they protect you against germs, viruses, bacteria, and foreign bodies. White blood cells struggle when you drink alcohol because it's hard for them to multiply, to reach the germs and fight off the disease. So you're more prone to infections. Number 3, there's reduced cytokine responses and coordination. What does that mean? So not only do you have low white blood cells, you have an immune system with cytokine signals, and these signals are important to coordinate their fight against the virus or bacteria. When you have decreased cytokine signals, you're unlikely to fight off the infection very well. So imagine the Army or the Air Force, the military defenses struggling to even know when to fire, where to find the enemy, and they can't really fight the infection very well, or the threat. So that's why alcohol is a risk to our immune system. Number 4, nutrient deficiencies. After long days, weeks, and years of alcohol consumption, most people tend to have low vitamin D, C, zinc, and especially B vitamins. We often see this in the ER or alcohol, but even in the clinic, I see patients who lack these important nutrients for their brain health, their mental health, and their total health. All these vitamins and nutrients are so essential for the immune system, not just for the virus or the bacteria, but really for daily life. Number 5, reduced antibodies. When you drink alcohol, you tend to have less antibodies, and that's pretty much no weapons for the army. You have nothing or less weapons to fight the invaders. So we know that inflammation is something important, not just when you have a cut, but also when you're exposed to viruses and bacteria. So when you have alcohol in your system, you have less of a defense and you're prone to more infections and even cancer. No one likes the C word, but it's true. Alcohol does increase the risk for cancer. We see it in colon cancer, rectal cancer, mouth, throat, esophageal cancer, liver cancer, and I know it's much more, and even in women with breast cancer. Think about it. How many years have you been drinking over time? Chronic drinking actually equals 12 to 15 years of drinking. And really, if you think about it, that might just be from the ages of 20 to 35. But most people are drinking all of their life, most of their life. So it's really important to take a holiday from alcohol. You can do dry January, or you can just reduce alcohol altogether. And don't forget, extremely heavy use of alcohol can throw the immune system off completely. 1 day of drinking can actually be really harmful, especially if it's 30 drinks in 1 day, but even binge drinking. Number 6, there's lung vulnerability when drinking alcohol. So I know I said in the beginning, we have to be careful because common colds are often from a night out. When you are drinking too much, you're probably eating processed foods and sugar, unhealthy things. And when you throw alcohol in the mix, it really worsens your immune system. So the lungs struggle to bring out the mucus, bring out the foreign invaders, and you tend to get more mucus, more plugs in your nose, in your chest, and are prone for not just sinusitis, but also bronchitis and pneumonia. Number 7, alcohol negatively impacts sleep. You tend to get poor sleep because even though you seem relaxed, it disrupts your normal sleep cycle. It actually inhibits the rapid eye movement and it causes daytime sleepiness. So I want to say when drinking alcohol, it not only disrupts the gut, the immune system, and the brain, but it also puts you at risk of many other infections and chronic diseases, including cancer. So be careful out there. I know that this is hard to hear, but I would say it's worth it because it can save your life. And for a bonus tip, binge drinking can decrease the number of T cells and B cells. This means that if you're consuming 5-10 drinks in one day, then you can actually decrease your immune system. And it's almost like being on alcohol for 6 months straight. Going back to define binge drinking is different for women. It's actually 4 drinks in one occasion, or for men, 5 drinks in one occasion. So if you're thinking about binge drinking, you may want to slow down, stay hydrated, have more fruits and vegetables in between, and definitely go home and rest after because you probably don't want to feel crummy the next day. See you again at Dr. Melissa's Kitchen, and you'll hear more about lifestyle facts, recipes, and all the good science out there.